Thank you for joining us. There's now a third confirmed coronavirus case in Wisconsin. It is the second one to hit Dane County. We have team coverage tonight.
That patient was treated at SSM Health. Madeline O'Neill shares how their hotline helped protect other patients in the clinic. But first, Amy Reed has new details on how this patient was exposed to the virus. Amy?
State health officials said both this case and the one from yesterday in Pierce County came after these two traveled to spots in the U.S. that are hotbeds for the virus. Now they want to make sure things don't get any worse here.
With the third case of coronavirus in the state, the second in 24 hours, state health officials want to make sure people are being careful with their travel.
We know spring break is arriving and that many families and individuals have travel plans. So we ask that you inform yourself and use your own best judgment about travel.
The two newly reported cases both involved people who had traveled to areas where coronavirus is spreading within the community. That's places like King County, Washington, Northern California, and New York City. They warned people should avoid traveling to those places or any of the places around the world where the virus is in the community. For areas it hasn't gotten that bad, there are still steps you can take to minimize spreading the disease.
We need to begin to change our norms around shaking hands. We can use our elbow or just give a little bow and greet people with a warm smile, and that can help us avoid the kind of contact that will accelerate spread of flu-like illnesses.
Another culture change she said we needed is fighting through symptoms to go to work. The group said that symptoms may not bother us, but it's about protecting the community, our coworkers and neighbors, while it's still easier to do so.
We know this is happening in the world. We know this is happening in the country. We expect that this outbreak will reach Wisconsin.
Those places where travel is ill-advised are listed online on the DHS and CDC websites. Madeline O'Neill is live at SSM Health St. Mary's Hospital with how the health system responded to this latest Dane County case. Maddie?
Right, Amy. Well, SSM Health has a process in place for dealing with potential coronavirus cases to help stop the spread to other patients. They put that into place this weekend when they say a patient who had recently come back from traveling within the country called the nursing hotline with coronavirus-like symptoms. That allows staff to prepare by the time the patient arrived to the nearest urgent care location.
We were able to meet this individual outside of our care facility, escort them through an area where there was no patient contact, put them in a proper isolation room. We were able to mask them and assure that all of our staff had personal protective equipment.
Unless it's an emergency, SSM recommends that anyone experiencing flu-like symptoms who has traveled to any countries or states with active COVID-19 outbreaks to call ahead before going to a clinic, urgent care, or ER. SSM officials say because of the way this latest case was handled, there's a minimal risk of the coronavirus spreading to other patients or staff. Coming up later tonight at 10 o'clock, we'll talk more about the health system's processes when it comes to dealing with potential coronavirus cases.
All right, Maddie, thank you very much.